It's already a multi-billion dollar industry to treat wet macular degeneration. But within that segment, there are a number of patients who don't respond or have some of these now we're increasingly aware of these negative side effects that they have.
Our goal was to try to come up with a therapy that basically treats this disease in like a more targeted way and that can be longer lasting in the eye so that you don't have to keep getting injections into your eye over and over and over again. Everybody that's working on these technologies, they're really focused on cancer as like the main thing to treat. And I was like, this would be perfect for the eye. Like, why is nobody doing this in the eye? I want to do this in the eye. So I contacted Dave and I was like, let's do this in the eye. We're trying to develop alternate therapies for a disease called age-related macular degeneration, and specifically wet age-related macular degeneration. So this is, I think, the most common cause of blindness among older Americans.
The wet form includes bleeding and leakage of vessels in the back of the eye, and it robs individuals who have the condition of their central vision, which is the vision we use to recognize faces, read, drive. So it's a really huge problem in the aging population, takes away their independence and really affects their activities of daily living.
The current therapy for this disease, it sort of works, but basically people that start taking this therapy, they have to stay on it for life. And the way that the therapy is delivered to the eye is by an injection into the eye. So people find these really unpleasant to receive. But another one of the problems with those traditional treatments is that they act indiscriminately. So the molecule that they're inhibiting, VEGF, that plays really important roles like everywhere in the body. It plays important roles like in really specific parts of your eye, so it can be dangerous to just indiscriminately add these VEGF inhibitors. VEGF is vascular endothelial growth factor, and it really is just a signaling molecule that helps blood vessels grow. We use a technology called targeted protein degradation. Basically, that's just taking advantage of waste disposal pathways that already exist in your cell. So like your cell already has like basically the garbage men that their job is to like get rid of the normal cellular trash. And our thought was that we could hijack these garbage men and kind of redirect them to these specific proteins. Or specifically to VEGF.
We were targeting a particular protein that promotes these abnormal blood vessels that grow in wet macular degeneration, and it does so very precisely. So instead of using a shotgun approach where we just try to destroy it everywhere, by selectively removing it only in certain areas and letting it do its normal job in other areas of the eye, we can hopefully get the benefits of eliminating the protein without the negative aspects of getting rid of it where it's needed.
We were like, we can find a waste disposal pathway that's really just localized right at that site of disease and design a therapeutic that hijacks that specific pathway. That would mean that the VEGF molecule can be preserved elsewhere in the eye and elsewhere in the body where it's really important to be active and just be removed at the site of disease.
Dr. Bisbach has done a tremendous amount of work already. We're still kind of in the early to mid phases of this project, but what she's already been able to demonstrate is that it does work well.
There's a lot of drug companies that are making these anti-VEGF therapeutics, and most people are using like these antibody inhibitor-based approaches. And my hope is that some of these companies will see this technology and realize how closely their existing products can be adapted to kind of fit into this this new therapeutic strategy.
It's important to note that in many regards, the eye is an excellent entry point from an organ standpoint for any technology. You have two of them, they're readily accessible, the surgical approaches are well worked out. So even if a company isn't necessarily focused on wet AMD or retina, having this type of technology as a first foray into its applications to the eye then opens up the gate into moving into other systems throughout the entire body for other diseases as well. And there's just an umpteen number of applications for that, not just in the eye, throughout the body.
Hi, I'm Andy Deteen, Director of Licensing at Wharf. To learn more about this high potential technology, please use the information on your screen. And to learn more about other high potential technologies, please like or subscribe.